Hey lovelies, welcome back to my channel. My name is Sarah, and today, if it's your first time to watch this channel, please subscribe. If you are a return subscriber, thank you for keeping on watching and commenting on this channel. We appreciate you so much. So without wasting or taking time, let's go and dive into implementation. We are still doing the OSCE Apie for midwifery. So we are done with the assessment, we are done with the planning, and now we're going to go into implementation. We are going to look at the marking criteria and then still go and look at how to go about the implementation. Okay, so we have here the implementation marking criteria for antenatal. We have the implementation marking criteria for labor, and then we also have the marking criteria for postnatal. So I'm going to read each one of them. It's going to be quite a long video because I'm going to combine the three of them because of time. I have still quite a lot to cover in that, so let's start off. Okay, anyways, I hope you're all good, I hope you're blessed, I hope you're all doing well. If you have any queries, please comment below and I shall get back to you. Okay, so let's start with the antenatal Apie implementation marking criteria. Okay, so one, it has 11 steps, or should I say criteria to follow. So number one, cleanse hands with alcohol, hand rub or washes with soap and water, dries with paper towels, following the World Health Organization guidelines. We all if you've watched my previous videos, you know we've gone through the 8 steps of the World Health Organization guidelines for hand washing, and then you 6 consent. Now that's number 2. 6 consent from the woman prior administering any medication. So as we all know, implementation is it's a doing. Should we call it a doing? It's an action station, and it takes 15 minutes. So they want to see you administer the drug, and before you do anything, even if you're going to just touch the lady, even if you're going to do anything, remember to ask consent before anything. You know, just like your child asks you, mommy, can I take this? Mommy, can I have some ice cream? Mommy, can I have this? It's the same way you should take this patient. Like, before I do anything, you should not assume anything that they'll accept. So inquire, ask consent for everything you want to do to this lady. Okay, so and then as you're asking consent, please tell the woman what you're going to do and what you require of her, and thus ask her permission, ask her if she's okay with that. Okay, then you check allergies on chat and confirms with the person in their care, and also notes the red ID wristband where appropriate. So from my previous videos, you've seen that we've been talking about asking about the allergies. Remember to ask the lady, do you have any allergies you know about? She may say yes or no. If she says yes, she must be having the red wristband. If she does not have the red wristband for allergies, please get the mother the red wristband and put it on her wrist. Update her notes, and also go on to update your colleagues about it. Okay, so they are aware and no one can make a mistake about it. Okay, so if this is not verbalized, giving the woman a red wristband and labels it. So if the red wristband is not there, verbalize it, please. So number 4, before administering any prescribed drug, looks at the person's prescription chart and correctly verbalizes all the checks. Person checks ID check verbally against the wristband where appropriate, and documentation, the drug, the dose, date and time of administration, route and method of administration. Number 5, correctly checks all of the following: validity of the prescription, signature of the prescriber, prescription is legible. So if any of these pieces of information is missing, unclear, or illegible, the midwife should not proceed with administration and should consult the prescriber. Okay. Number 6, briefly acknowledges any potential side effects and contraindications where relevant, and medical information prior administration. Yes, at the end of this video, I'm going to also include the common medications, and at the end of the video I said I'm going to include some of the common medications and their side effects, so you are familiar with certain kind of medications you expect. I'm not saying they will appear, but those are the sort of common medications that mostly are used by midwives, so who knows. Then in case then we go to number 6, briefly acknowledges any potential side effects and contraindications where relevant, and medical information prior to administration. Yeah, so in case you're unsure of anything, there is always a BNF besides your working place, so you can check the drug and get the actual information, give the actual information to the patient. Okay. 7, provides a correct explanation of what the medication being administered is for to the person in their care. Okay. Like if you're giving a painkiller, you tell the mother this is an analgesic and it will help you to cure your pain. Okay. So then we have administers drugs due for administration correctly and safely. So before you administer the drug, as you're doing your checks, make sure you check the expiry date, check the drug milligrams, check is it the correct drug you're giving. Okay. And then considers pain relief requirements. Number 10, accurately records drug administration and drug non-administration. So if you've given the drug, there are codes that you use. We shall go through the drug administration chart. There are codes that you use to write that I've given this drug. And then if you've not administered the drug, still there are codes that you use to show reason as to why you've not administered the drug in the drug chart. 11, acts professionally throughout the procedure in accordance with the NMC 2018, the code professional standards of practice behavior for nurses, midwives, and nursing associates. Okay, so we are done with the implementation marking criteria for antenatal. So we're going to go through the implementation marking criteria for labor and birth, Apie. Okay, so these are 9. No, they're more than this. Yeah. The marking criteria for labor and birth implementation is 9. So we're going to go through this. So number 1A, cleans hands with alcohol hand rub and washes with soap and water and dries with paper towels following WHO guidelines, and puts on disposable gloves and apron. Okay. 6, consent from the woman prior administration of medication. I've explained all that previously, so let me not dwell on it a lot. Checks allergies documented in the medication chart and confirms with the person in their care. Also notes the ID wristband where appropriate. Before administering any prescribed drug, looks at the woman's prescription chart and checks verbalizes all the following: person ID checks verbally against the wristband where appropriate, drug, dose, date, and time of administration, route. Number 4, correctly checks all the following: validity of the prescription, signature of the prescriber, prescription is legible. If any of this information is missing or unclear or illegible, the midwife should not proceed with administration of the drug. Number 5, briefly acknowledges any potential side effects and contraindications where relevant. Then, and medical information prior to administration. Then we look at provides correct explanation of what the medication being administered is for to the person in their care. 7, demonstrates the safe preparation of the drug, of the prescribed drug due for administration. 7b, demonstrates the safe administration of the prescribed drug, including checking expiry date. 7c, demonstrates the safe handling and or disposal of sharps. Then 8, accurately records drug administration and non-administration on the medicine chart. Okay. Then acts professionally throughout the procedure according to NMC 2018, the Code, Professional Standards and Practice of Behavior for Nurses, Midwives, and Nursing Associates. I think you can see the similarity in the implementation. Okay. So the implementation is almost the same in all the APIs. Okay. And remember, it is a 15-minute session. You should be able to finish quickly. So we're now going to the implementation of the postnatal API. Still almost has the same marking criteria like the previous two, and that's why I decided to add them together so you can see clearly why I had to add them. So number 1 in the implementation for postnatal API, we have cleanse hands with alcohol, hand rub, or washes with soap and water, dries with paper and towels, following WHO guidelines. 2, seeks consent from the woman prior administering medication. 3, checks allergies on charts and confirms with the person in their care. Also notes the red ID wristband where appropriate. Before administering the prescribed drug, looks at the person's prescription, correctly verbalizes all the following checks. Person checks ID, the wristband, drug, dose, date and time of administration, route and method of administration. Okay. Correctly checks all the following: validity of the prescription, signature of the prescriber, prescription is legible. If any of these pieces of information is missing, unclear, or illegible, the midwife should not proceed with administration and should consult the prescriber. Okay. 6, briefly acknowledges any potential side effects and contraindications where relevant, and medical information prior administration. Provides a correct explanation of what the medication being administered is for to the person in their care. 8, administers drugs due for administration correctly and safely, checks expiration dates. 9, accurately records drug administration and non-administration. Explained about that. The codes are well written on the drug chart on what to use for drugs administered, and for those not administered, there is you still have to give the reason why they're not administered. Okay. And then we number 10, acts professionally throughout the procedure in accordance with NMC 2018, the Code, Professional Standards, Practice and Behavior for Nurses and Midwives and Nursing Associates. So briefly, that is the 3 implementation for antenatal, labor and postnatal. So now we're going to go into how to go about the implementation. Just as you've seen the similarities, the same with how to go about it. I'm going to just specify on where we have some changes on what is specific to each, and then also we see the common medications that we expect. Okay. Let me see something I wanted to show you. Okay. So like, I don't know if you can able to see this in the drug chart, but these are the codes stating the modes of delivery. So in case you've seen anything here, these are the example of codes. So these codes are what you use when you tick off when you use a when you're talking about the drugs that are given or not. Hey, so implementation. How do we go about it? Do. Just to remind you, this is a 15-minute station. It's the third in the Apie. So how do we go on with implementation? So you assess the room for slips, trips, and falls. That means making sure that there's nothing on the floor is dry, there's nothing that can make someone have a fall or have an accident. Okay, so performs hand hygiene and air dries for 15 seconds. You perform hand hygiene according to the WHO, as we've seen. Then you close the curtains for privacy and dignity. That is also the windows, adjacent windows that are open. Okay, so you introduce yourself. Hello, I'm Sarah. I'm going to be your midwife today. I can see the doctor reviewed you and prescribed some medication for you. I'm here to administer your medication. Are you happy for me to start? Okay. Can I confirm your name and date of birth, please? Okay. I will double check with your wristband. So if mother says, my name is Nasuna Jamira, date of birth 12 January 1994. So I'll double check with the wristband to make sure that's exactly what is there. Then I'll go on and ask them also for the hospital number if it's necessary. And I'll ask her, do you have any allergies? Do you have any allergies you may know of? And what happens when you take the drug that causes your allergy? Okay. So the mother may also may not be a drug, but may be allergic to latex. You know, some people are allergic to latex that we use in the gloves. So make sure then you use latex-free gloves. Okay. So then I will document. You document it and make sure that you know. Then you tell the mother, you assure her that I'll document this and I'll make sure no one gives you anything that contains something you're allergic to. Okay. So we're going to then you go to read out the first part of the drug chart, the height. So this is the drug chart. So it's saying you read out the first part of the drug chart, the height and the weight. As we see, this is the drug chart. It has the surname, forename, then the date of birth, hospital number. It has the height, weight, body mass index. So you make sure you read out loud all that. Okay, so you're reciting it out to the patient and the examiner. Okay, just as I was telling you, we go through whatever is on the top part of the chart, where you have the details that I've been showing you, and then you go on to the start use, talk about the start dose on the sheet, the date, time, the drug, dose, route, prescriber's signature, given by, checked by. Given by is you, your name. You're the one giving the drug. As you see here, where there is Nasuna Jamira, so that's the person who's given the drug, the initials, the signature, and the base. So the base is the place where you're working. Are you in labor ward? Where are you giving the drug from? Okay. So, and then you say, okay, therefore I'm happy that this is the right patient and the right drug chart. Okay. Then you go on to ask the patient, Jamira, do you take any regular medications? So it depends. Some of them, if they are maybe like diabetic, or if the mother is in a neonatal, maybe they're taking ferrous, or it depends. If they have any background of any illness that they take medication on, please get that. Then did you have paracetamol? When did you have paracetamol, any painkillers last time? Go on to ask, do you have any problems with swallowing medication? Okay. Now I'll go and prepare your medication. Here is the buzzer to call when you need me. Okay. Then you go wash your hands again, put on your PPE, go out and go beside your drug trolley. So when you go to the drug trolley, you need to confirm with the examiner, can I confirm my drug trolley is clean and the stock is ready for use? Is it unlocked? Okay, so then you say, I got some water for my patient at the medicine pot. Remember, if you administer more than one drug per each medicine pot. Okay, do not mix up medication. If you have paracetamol and maybe which other drug? Okay, any other drug, just put paracetamol in a different pot, put the other drug in a different pot. Even if you have a third one, it has to be in a different pot. So again, you go and read out the pages out loud, starting from page 1, page 2, page 2. So read all the pages from top to bottom. Everything. Don't say, oh, as previously. No, they want you to verbalize everything fully. Okay, so then you can say, after you've read everything, so then you go on and say, I'm happy to after this reading this each section, then you and for each drug, and then you'll say, all the details show me I have the right errors. What are the right errors? The right drug, right dose, right patient, right time, and the right route. Okay, so I'm happy to administer this drug. Then you go on and say, if and make sure if the patient told you they took medication like before, like if they took paracetamol in the morning and it's just midday, so you make sure you confirm the right time. Like paracetamol should be taken after 8 hours, so they should bid you to take the next dose that you're giving them. If they're not yet due, say, I'm not happy to administer this drug. Okay, take note of that time. Okay, but no one is gonna trick you onto anything. Okay, then you go on, if the drug, like if the drug is levothyroxine and it's administered in the afternoon, I'm going to say, because levo is a morning drug, I'm not happy to administer the medication. I do not find if the drug does not contain the doctor's signature or the start date is not mentioned on, or it's uncompleted prescription, I'm not happy to administer. If anything is incomplete, please do not administer. If you have any IV drugs, please ask the assessor, does my patient have a working cannula? Because if she has a working cannula, it goes fast. I'm not happy to administer this medication. That is if the cannula is not working, but don't say it's not working, because they want you to see the procedure, so it's very rare to have that this one is not working. Okay, so if any medication is not documented, is not administered, please document at the back of your drug chart. Okay, then what I was also wanted to clarify is about the PRN medication. Ask the patient when they had the last relief. Okay, just as the example of paracetamol I was giving you. Then make sure you tell the patient you're not happy, and you will inform the doctors to see if you can get another drug. That is for those who have pain that comes. Remember to always sign remember to always indicate your name and also sign and the date, and also remember to confirm the name of the patient on each page of the drug chart. Okay, so sometimes there may be gaps whereby we have maybe the antimicrobials or the antibiotics, so it depends. Just make sure if it's blank, you have to clearly note it. Okay, so if they're regular medications like ferrous sulfate, if the time has passed, indicate the code. If the patient is not on the ward, indicate the code, like code 1, and you sign. Okay, so when you're doing IM, you have to prepare using the right expiration, hand hygiene, confirm with the patient, ask the allergies, give indication, give contraindications, side effects of drug you're giving. Remember to check the BNF if you're unsure, okay? So it's better than saying something wrong, okay? So then you tell the mother, hello, Jamira, I'm back again with your medication. Can I check with you your full name, date of birth, and the hospital number? Again, do you have any allergies? No. So now you'll say the drug, what the drug is for, and the side effects. So maybe my drug is paracetamol. It's a pain relief. Some of the side effects you may face are nausea, vomiting, dizziness. Okay, so let me go on to give you some of the common drugs and their side effects. Okay, number one, let's start with the paracetamol. It's usually 1 gram within 4 to 6 hours. It's a pain relief. Side effects may include dizziness, nausea, and vomiting. Then we have betamethasone, which is which may be 200 milligrams or 1 ml injection that helps to mature the baby's lungs. Side effects are pain, redness of the injection site. So we may have cocodamol, which is usually 1 gram. It may be QID or TDS. It's a pain relief. Side effects are nausea and vomiting. We may have ferrous sulfate, which is 200 milligrams, which is tedious for anemia, and side effects may be constipation and diarrhea. It depends, people's bodies react differently, so just because someone has constipation doesn't mean that. Then we also have cefalexin, which is an antibiotic, which is usually 200 to 500 milligrams QDS. So you have to make sure it's an antibiotic for mostly treatment of UTI. So side effects may be allergic reactions like itchy skin, rash, nausea, diarrhea. So you should be avoided in penicillin allergic patients. Then we also go on to see erythromycin, which is 200 milligrams, and it's an antibiotic used to treat STDs. Side effects may include nausea, vomiting, diarrhea. Okay. Then we go on to say to avoid penicillin allergic. Also avoiding penicillin allergic patients. So we have amoxicillin, which is 200 to 500 milligrams, TDS antibiotic. Side effects are nausea, vomiting plus rashes. Avoid in penicillin allergic patients too. Then we have camoxiclav, which is 625 milligrams TDS. It's an antibiotic to treat against UTI, and side effects may include diarrhea, nausea, and vomiting. I think the common side effects: nausea and vomiting. If it's an injection, remember to include pain at injection site or redness. Those are must miss of every. At least every drug can do that. Then we have cyclizine, which is usually 50 milligrams. It's an anti-sickness. So side effects, you may get dry mouth, headaches, constipation. Okay. So after giving the explanation of the drug, so you ask the mother, are you happy to take it? Consent. Okay. When you have given all the medications, you talk to the mother and tell her, okay, I'm done with your medications. Now I will go and document everything. If you have any of these side effects and you need help, the buzzer is here. Please let us know. Call us. Anyway, the buzzer just rings, so you see, you just come. This is my side effect of the injection site. I've had a cannula in the previous days and see how my skin looks like. That's some of the side effects. Something for you to remember. What's this? Redness at the injection site. Okay, so we dispose of our PPE wash. We're finally done. So you dispose of your PPE, do your hand wash, and start your documentation. Remember to put the PPE in the infection waste bin, and then go through your documentation to make sure you've not forgotten anything. Thank you so much for listening in. What else can I tell you about implementation? But basically that's it. So you're either going to administer tablets or you're going to give an injection. So just make sure you remember how to give the injection. Remember, for the medication, just make sure you go and you go well knowing some drugs, because the VNF will take time. It's only 15 minutes. By the time you go through the drug chart, 1, 2, 3, 4. The 15 minutes are gone before you even document your things. So if you can't document on the go, so that's it, lovelies. Thank you so much for listening in. If you have any questions, please ask in the comment section. I'll clarify. I'll try to do a full filling in of the drug chart, so we are all trying to get familiar to it. If you've never seen it, then prescribe, share, and also recommend to others who may need it. Okay, thank you for watching. Love you all.